If you're a lady planning to get pregnant or you're already pregnant, you need to listen to this. Pregnancy for a whole lot of women is a very smooth and seamless journey. But for some, it doesn't go as planned. They can encounter one or two complications. If you have an existing medical condition, it could make these complications worse. But for some people, pregnancy itself triggers a whole lot of medical condition. If managed very well, can disappear after childbirth. Or if you're unlucky, you can get that condition for life. And if you've never had complications in your previous pregnancy, it doesn't mean that future pregnancy will also be free of complications. Every pregnancy is different and it should be treated as such. Diabetes in pregnancy is very common. It is called gestational diabetes, when a lady develops high blood sugar level while pregnant. This gestational diabetes can lead to birth complications, giving birth to a very large baby, hypoglycemia, or even difficulty in breathing for a newborn baby because their lungs did not develop well. There is also hypertension in pregnancy. Pregnancy can trigger high blood pressure, and this is very common from 20th week of pregnancy and above. If not managed well, it can lead to preeclampsia, which is when the kidney, the livers are involved. There's water retention. When you see pregnant women, their legs swollen, if not handled very well, can lead to eclampsia, which is a very severe medical condition that could lead to seizures, stroke, and even death for both the mother and the child. So detecting and managing this would help save ladies from complications during pregnancy. For some health facilities, they're already doing well in terms of checking women's blood pressure while they are pregnant. They come for antenatal, they do all necessary checkup. But for some facilities, you just go there, sing, dance, gossip, and go. If you are in this category, you let the doctors know what you want. Request for the test yourself. There is also toxoplasmosis. This is usually asymptomatic, meaning that you can have it without having any symptoms. But this can lead to birth problems like mental or even physical problem for the unborn baby. To avoid this, don't come in contact with cat feces, because cat feces is the main carrier for this disease. If you must come in contact with cat feces, you need to wear gloves and dispose of it appropriately. You shouldn't eat undercooked meat or even raw meat at all when you are pregnant to prevent getting this particular disease. Then there is also sexually transmitted diseases. For mothers who already have this infection before pregnancy, it is advised that you treat yourself very well before you become pregnant. But if you are pregnant and you still detect this infection, treat it as soon as possible. The last but not the least is food poisoning. It can happen to anybody, but in pregnant women, it is very dangerous because it can lead to dehydration, malnutrition for the unborn baby, meningitis, or even pneumonia. So know about this, save yourself and save your unborn child.